In medical school, they teach us to look for the loud emergencies, the broken bones, the heart attacks, the strokes. But after years of seeing patients, I've realized that the most dangerous battles often start in total silence. Imagine for a moment that your body is a fortress. For your entire life, and Veth had an elite security force patrolling the walls, keeping you safe from invaders. But then one day a communication line gets crossed and a switch is flipped, and suddenly that security force turns its weapons inward. They aren't fighting a virus anymore. They are fighting you. This isn't science fiction. This is the reality of autoimmune disease. And the terrifying part is that in the beginning, it doesn't look like a war. It looks like nothing, and it looks like just getting older, and it looks like just a little stress. But deep inside, at a cellular level, a catastrophic failure of tolerance is happening. And today we are going to walk through the 7 critical deadly signs that your body has started a civil war. These are the red flags that get missed in standard 15-minute checkups, but knowing them could quite literally save your organs from irreversible destruction. Before we go any further into these signs, I want to ask you to do something for me and for yourself. If you are someone who believes that understanding your biology is the first step to healing it, please take a second to hit that subscribe button and join us. We are building a community here that values deep, scientifically accurate health information over quick fixes, and I'd be honored to have you with us and we unravel these medical mysteries together. I also need to state a brief but important disclaimer. The information we are discussing today is educational and grounded in high-level medical research from institutions like the Mayo Clinic and Johns Hopkins, which I've listed for you in the description. However, these signs can mimic other conditions. So use this video as a tool to start a conversation with your healthcare provider, not as a replacement for a professional diagnosis. Let's begin with the first sign. And honestly, it is the one that patients are most often gaslighted about. It is a profound, debilitating fatigue. Now, please listen closely. I am not talking about the kind of tired you feel after a long flight or a bad night's sleep. That is physiologic fatigue, and it gets better with rest. The fatigue of autoimmune disease is pathologic. It is heavy. It is physical. Patients often describe it as feeling like their blood has turned to lead, or like they are wearing a suit of armor they can't take off. You could sleep for 12 hours and wake up feeling like you haven't slept a wink. Why does this happen? It's not in your head. It's in your cytokines. When your immune system is active, let's say in lupus or rheumatoid arthritis, it releases massive amounts of pro-inflammatory proteins called cytokines, specifically interleukin-6 and TNF-alpha. These proteins enter your bloodstream and travel up to the blood-brain barrier. They cross into the central nervous system and hijack the hypothalamus, the part of your brain that regulates energy. They force your brain into a state of sickness behavior. It's an evolutionary trick designed to make you stay in a cave, so you can heal from a wound, but in autoimmune disease, the wound never heals. So you were trapped in a permanent state of biological shutdown. But there is a second layer to this fatigue that is even more fascinating and terrifying, and it's happening in your mitochondria, the power plants of your cells. New research suggests that in autoimmune conditions, your mitochondria stop focusing on making energy, ATP, and switch modes to help the immune defense. They literally stop being power plants and start becoming defensive bunkers. And this creates a cellular energy crisis. Your muscles simply do not have the fuel to function, which is why simple tasks like folding laundry or walking to the mailbox can feel like running a marathon. It is a metabolic theft happening inside every cell of your body, and a second deadly sign is hidden in the rhythm of your mornings. I want you to pay attention to your joints. Most people get a little stiff as they age. That's osteoarthritis or mechanical wear and tear. That stiffness usually lasts 10 or 15 minutes, and then you shake it out. But autoimmune joint pain, like we see in rheumatoid arthritis or ankylosing spondylitis, is completely different. It comes with a warning sign called morning stiffness, and the magic number here is 1 hour. If you wake up and your hands, knees, or back feel locked up, frozen, or swollen for more than 60 minutes, that is a major red flag. This happens because of a process called the gel phenomenon. And while you are sleeping and inactive, the inflammatory fluid in your joints, which is full of proteins and immune cells, accumulates and thickens. It literally turns into a gel-like consistency, like gelatin setting in a mold. When you wake up, You have to physically work that joint for an hour or more to pump that fluid out and turn it back into a liquid. This isn't just aging. This is active synovitis. It means your immune system is attacking the lining of your joints while you dream. And if we ignore this morning stiffness, the consequence is deadly for the joint itself. That inflammation eventually forms a destructive tissue called Pannus. Think of Pannus as a creeping vine or a tumor made of immune cells. It grows over your smooth cartilage and releases acid-like enzymes that eat right into the bone. Once that bone is eroded, we cannot grow it back. That is why recognizing that 1 hour window of stiffness is so critical. It's the only time we have to stop the Pannus before it eats the joint alive. Now, let's move to the surface of the body. The third sign is written on your skin, but you have to know how to read the language. So we often talk about rashes, but autoimmune rashes have very specific signatures. The most famous is the Malar rash or butterfly rash of lupus. It appears across the cheeks and the bridge of the nose. But here is the detail that saves lives. It almost always spares the nasolabial folds. Those are the little laugh lines that run from your nose to the corners of your mouth. If you have a red sunburn-like rash on your face, but those creases remain pale and unaffected, that is highly specific for lupus. Why does this rash happen? It's often triggered by the sun, and this is called photosensitivity. In a healthy person, UV light damages skin cells slightly, and the body cleans them up. In an autoimmune patient, that cleanup crew is on strike. The dead cells linger, and their insides, their DNA, get exposed. Your immune system sees this exposed DNA, thinks it's a foreign virus, and launches a massive attack right there on your face. This isn't just a skin problem. It's a sign that your body is attacking its own genetic material. The fourth sign is a sudden, unexplained change in your weight. And I don't mean a few pounds after the holidays. I mean drastic shifts that defy the laws of calories, and this usually points us toward the thyroid or the gut. In Hashimoto's thyroiditis, your immune system essentially destroys the thyroid gland, which is the engine of your metabolism. Imagine driving a car and someone cuts the fuel line. It doesn't matter how hard you press the gas, the car stops, you gain weight rapidly, you feel cold, and you are puffy. Your metabolic fire has been extinguished by your own antibodies. On the other end of the spectrum is celiac disease. This is not just a gluten sensitivity, it is a violent autoimmune attack on the small intestine. And when you eat gluten, your immune system attacks the villi, the tiny shag carpet-like fingers that line your gut and absorb nutrients. In celiac, these villi get completely flattened. It's like turning a lush forest into a parking lot. You can eat the healthiest, most expensive organic food in the world, but if your absorption surface is destroyed, you cannot get the fuel into your blood, you lose weight, you become anemic, and your bones starve for calcium. The fifth sign is deceptively simple but dangerous if ignored. Recurrent fevers and swollen lymph nodes without an infection. You feel hot, you take your temperature, and it's 99.5 or 100 degrees. You have swollen glands in your neck or armpits. You assume it's a virus, but it happens again next week. And the week after, and this is what we call tumor fever or autoimmune fever. It's not caused by bacteria, it's caused by internal heat. So your immune system is releasing pyrogens, heat-generating signals, because it is in a state of constant high alert activity. The lymph nodes swell because they are the barracks of the immune system. When the body decides to attack itself, these barracks go into overdrive, producing millions of lymphocytes. In conditions like lupus or sarcoidosis, or even precursors to lymphoma, these nodes stay swollen for months. A lymph node that is hard, rubbery, and doesn't go away is your body screaming that the immune system is hyperproducing cells for a war that doesn't exist. Number 6 is hair loss, and this is often the most emotionally devastating sign for patients. We aren't talking about standard male pattern baldness. We are talking about alopecia areata. This is a specific targeted assassination of the hair follicle. Your T cells, the hunter killers of the immune system, swarm around the bulb of the hair root. Under a microscope, it looks exactly like a swarm of bees. They attack the root, cutting off its nutrient supply. The hair, having no choice, stops growing and falls out, leaving a perfectly smooth, round patch of skin. But it's not just patches. In lupus and thyroid disease, the hair becomes brittle, dry, and thins out all over. This is telogen effluvium. Because the body's in a state of emergency, it diverts resources away from non-essential, things like hair growth, to focus on vital organs. Your hair is metabolically expensive to grow, When your body is fighting itself, it cancels the budget for your hair. It's a sign that your system is in survival mode, prioritizing the heart and lungs over your appearance. Finally, the seventh sign, and perhaps the most frightening one, is what we call brain fog. But I really dislike that term because it sounds harmless, like you're just a little groggy. Medically, this is neuroinflammation. In severe autoimmune flares, the blood-brain barrier, that strict security gate that protects your brain, becomes leaky. It allows inflammatory cells and antibodies to break into the brain tissue. This is a violation of the body's most sacred sanctuary. Once inside, these invaders activate the brain's own immune cells called microglia. Now, normally, microglia are gentle gardeners. They prune dead neurons to keep the brain healthy. But when they get inflamed, they become aggressive. They start overpruning. They eat the healthy synapses, the connections between your thoughts. This is why you walk into a room and forget why you're there or why you can't find the work for spoon. It's not early dementia. It is an immune attack on your neural connectivity. So, why did I take the time to walk you through these 7 signs in such detail? Because the gap between your first symptom and a diagnosis is often years, sometimes 5, 6, or 7 years. And that is years of damage that we cannot undo. If you have the gel phenomenon in your joints, or the butterfly shadow on your face, or the brain fog that won't lift, you now have the vocabulary to advocate for yourself. You can walk into a doctor's office and say, I am concerned about autoimmune pathology. Don't let anyone tell you it's just stress or just aging if your gut tells you otherwise. Your body is speaking to you. It is asking for a ceasefire. And with the right blood work, checking your ANA, your rheumatoid factor, your thyroid antibodies, we can broker that peace treaty. We can calm the immune system down before the damage is permanent, but it starts with you noticing the signs. So thank you for giving me your time and your attention today. If this video helped you connect the dots for yourself or a loved one, please share it. You never know whose life you might change just by sharing the right information at the right time. Stay curious, stay persistent, and most importantly, take care of that fortress. I'll see you in the next video.